And now I'd like to show you how you can do self-massage to improve your issues with TMJ. So again, everybody has TMJ. It is a joint in our head. So this is the skeleton that's underneath everybody's meat suit, at least for the most part in general. But here's our mandible. And so this is what is able to move separate from our skull because of this joint, the TMJ joint. So T for temporomandibular joint. So you can see there is a little cushion here. I don't know if it shows up well on the camera, but there is, because it's a hinge joint, there is going to be a disc in there for cushioning that joint. And there can be issues that happen within the bony structure with that disc that won't be alleviated by doing self-massage. However, I can tell you that if you do have issues with the joint itself or with that disc, it is going to cause more muscle tension, and therefore doing self-massage can lower the pain that you're dealing with or lessen the symptoms that you're experiencing. And a lot of TMJ issues really have nothing to do with the structure of that joint, but really come down to just the tension in the jaw and all the surrounding structures, all the muscles. That's where this will come in and will be one of the many techniques you can use to help improve your condition. Now, I say one of the many techniques you can do because you could certainly do some massage on your head, your scalp, working on the temporalis in this area, massage over the outside of the face. Again, general relaxation, CBT, working with a therapist, lots of things you can do to help TMJ. But in this video, what I'm going to be showing you is how to do your own self intraoral work. So intraoral work means that we are working within the mouth, but we are only going to be working within the mouth and outside of the teeth. So I know it can sound scary to have massage work done in the mouth, but again, we will not be within the teeth at all. So the teeth not need to be opened. It's all going to be outside of the teeth and between the teeth and the jaw area and the cheek. So when we do this work, when we are working on ourselves, we are going to be using our left hand to work on the right side, our right hand to work on the left side. So I want you to keep that in mind as I demonstrate. Also, when you do this work, I recommend that you are doing it lying down. You can be on your bed, on the floor, but when you lie down, you're able to relax all those muscles of the head, neck, and face that when you're up, holding your head up, they can hold more tension. So again, watch the video and maybe even just watch it once and then play it in the background as you work through that maybe, or just give it a try. But again, you want to do that laying down if at all possible. So when we start, we are going to start by parting the lips and then coming in. I'm going to show you on the skeleton what it will look like if I did not have tissues covering. So once I put my finger in my own mouth, it's going to be really hard to see what I'm doing. And I'm also going to be a little unclear in my speaking because I'll have a finger in my mouth. So what it will look like is, again, I'll be using my left hand to work on the right side. My finger is going to come in this direction. So with the fingernail, the nail bed against my teeth. So imagine this is me. My finger would go in and I would follow this bonier part above the teeth, the upper gums, all the way back. Now, when I come back initially, I do like to work medial to this coronoid process. Just because there can be some tension in that area. There's not a whole lot of room to move in there, so it's going to be an up and back, a little bit of movement. Seeing if you can basically move back a little further, softening up some tension before we then pull our finger back out a little bit. So not all the way out of the mouth, but just back it up so that you can come around that coronoid process. You might be able to do a little bit of work above, but we're going to then focus on working lateral to the outside of that coronoid process. From here again, the fingernail is facing in toward the face. We're going to come up and back as high as we can. At this point, you're going to notice if you took your outside hand or if you looked in a mirror, you'd see that finger moving out here for the rest of this stuff. And it's going to come up, and then we're going to kind of work in this arcing motion where we're kind of coming up and out and down, stretching that tissue down. Now down around this area, I really want you to take time, move slowly. This tends to be an area that really holds a lot of tension. So it's going to be a downward pressure. We're not pressing in toward the bone, but again, stretching that tissue down and off of the bone. So it's a back and down, and then here it's just dragging down and down and down and down, moving very slowly. Again, I'm demonstrating way faster than you'll actually be working. I want you to take your time here. And eventually the finger comes out when we get to about the pointy teeth. They might coming out around there. We don't want to go all the way to the center and risk tearing the little piece of skin that's holding our lip in place. And that's where our finger will come out. Now, Another thing to note is as you go in, make sure you aren't stretching your mouth wide open. This part of the hand will stay very medial while the finger is going outwards. You want to be like this, not like this. Another thing to pay attention to again is going slowly. Slowness is going to make the biggest importance. Slow and being relaxed. So any body work can cause some sort of trauma or stress. If at any time it begins to be overwhelming, you notice your heart beginning to race, just simply remove your finger, relax, maybe lay your arms at your sides, remind yourself that you're safe. A lot of trauma causes jaw issues. Not that your jaw issues don't necessarily stem from trauma, but sometimes when we go to resolve some of that tension that we're feeling, it can come out in the body. Our body's not sure about this change that you're wanting to make happen. So just move slowly. Take your time. Remind your mind and body that you're safe. Try to do your best to breathe slow and deep as you're doing this work. So I'm going to go ahead and demonstrate this on myself. Remember, I'm a massage therapist, not a doctor. I'm going to step in a little closer here so hopefully you can see the work a little bit better. And again, this is just for you to try on yourself at home. We're always going to stay outside of the teeth. You should work within your comfort level and never try to push or force anything. We're just going into where we feel the tension, where we feel discomfort, and we're waiting. We're going to breathe. We're going to use our breath and our awareness to help those issues in the tissues soften. So every time you feel that tension, just breathe. Think about it relaxing. Remind those tissues that they're safe. They can let go. They don't need that tension. The more you do that, the more benefit you're going to notice. So again, remember to take your time and breathe. If at any time you need a break, just take that break. You can always come back. We don't need to add to your trauma. So as you bring your hand to your face, again, it is going to be left hand to right side. That finger is going to go within the lips. We just need to part the lips, not the teeth really. And you can see here I'm staying outside of the teeth. So initially I'm sliding right along that upper gum line. So you're not going to see my finger sticking out initially. I'm going to come up here and I'm just going to hold. I could even, as I'm holding, slowly open and close the jaw. Just stretch that tissue a little further. Now, generally, I would wait here a little longer, but it won't make for a very interesting video to watch me standing here waiting. So I'm going to continue with now taking my finger out from behind that the cornine process, coming out underneath the zygomatic arch. And now you can see that happening here on my face. You can see that tissue stretched out. You can see my finger there. So up here, you may notice a lot. You may not notice too much. Just see what you notice. Breathe, wait, see if you can get it to stretch a little further as the tissue softens and lets go. Then we're going to slowly, so again from up here, we're going to slowly rotate that finger down and down and down. Back here, it starts to get a lot more tense because we're starting now to get into the masseter. The masseter is big, it can be really thick. Take your time here. You're welcome to even like friction a little bit if you like, or just hold, stretch it down and back. You can see that happening on my face and here by the skeleton as I work. Slowly taking it down and back. And once we're at the bottom, then we're just slowly coming down, stretching again downward, not so what I was going to say there is not pressing into the bone. Let me dry that off. Not pressing into the bone, but again, just stretching that tissue down and away. Now, like for instance, as I was working here, I did feel a lot of tension in one particular area. I can go back and just work that area. In between doing each side, I suggest just pausing, resting, observing. Notice what you feel. Do you notice that one area is still holding some tension, needs a little bit more work? I recommend always doing both sides, but observe the differences. If you notice that one side is tighter, start on that side. If you're not sure which side is tighter, just pick one. You might even massage from the outside to decide which is tighter, where you want to begin. And just know you should always work both sides, but they won't necessarily take the same amount of time. It will all be dependent on how tight the area is, how tight that side is, and how slow you move. Again, take your time. After you've done both sides, again, pause, relax, breathe, notice, do they feel balanced? Do they feel even? Do you feel like you need to go back and do it anymore? If so, go ahead and do so. Another thing that I've noted is with my own jaw tension, I get a lot of spasming in my head, my temporalis on my left side up in here. And what I found is it's actually because my right masseter gets really tight. So don't necessarily just base it on, one thing. Look around for different things. And one of my indicators, I realized it was really that I was pulling more to my right, was that my teeth sometimes don't line up. So check, notice, do your teeth line up, the top and bottom? Because if the bottom teeth are out of alignment, now maybe they're always out of alignment, something you need to know about yourself, but if they're generally in alignment and then you're having issues and you look in your jaws like this, now your bottom teeth are over here, well, that's an indicator that you're having more tension on the left side, so you might want to work that more, and then maybe do a little on the right and go back to the left. Again, this work is going to be dependent on, what you notice in your body as you work. That's why, again, I do encourage you to work with a professional whenever possible, but we can't always do that. And sometimes we can be more effective working on ourselves. So give it a whirl, wash your hands, clean short nails, lie down, and then stick your hand in your mouth and see what you find. Again, staying to the outside of the teeth, left hand for right side, right hand for left side. Give it a try. And please leave me a comment. Let me know what you think. Was this helpful? Was it useful? Will you use it? Did it work? But I'd love to hear back from you. Give me a subscribe and follow, and know that I'll be posting more and more videos on here that help you to help you help yourself more and live your best life. That's what we all want to do, right? Take care and have a great day.